presenters today, and we've built in a number of opportunities for you to be active participants too. So thank you so much for joining us today. Next slide, please. My name is Lisa Kaufman. I am a senior advisor in the Office of the Deputy Assistant Secretary for Special Needs at the U.S. Department of Housing and Urban Development. I am serving as the facilitator for today's webinar, and it is a privilege to have so many of you here with us. I know how busy folks are during the day, so the fact that you took an hour out of your incredibly busy day to be with us on this webinar, we greatly appreciate it and hope that we've put together informative material for you to take back and replicate in your community. Your active involvement in the webinar is essential for us to have an engaging discussion today. Next slide, please. So here's our agenda. Today, after our initial opening and poll, we will spend a few minutes on why preventing and addressing homelessness needs all of the sectors here on this webinar to come together. We serve the same people. You're in for an incredible conversation, a treat today, inspiring example from San Diego, California. We'll ask you for some takeaways in the chat, and then taking the questions that you submit via the Q&A function. We'll spend about 15 to 20 minutes answering your questions. Finally, we'll share some technical resources and wrap up right on time. Next slide, please. All right, so let's get into some housekeeping items. This meeting is being recorded, so by staying to participate in the webinar, you're consenting to the recording. Also, all attendees have been muted for audio quality. Please use the chat, as many of you already are. It's so good to see where everybody's from. So definitely use the chat to make comments, identify yourself, and talk to your fellow attendees. We will also prompt you to answer some questions in the chat later in the webinar. And as for questions, this is really important because we want to take as many questions from you all as we can today. Please submit those at any time using the Q&A feature that's in the Zoom dashboard. Due to the size and pace of this webinar, we're not going to be able to respond to raised hands. Instead, we're asking you to please use the Q&A function to ask questions. The only questions in the Q&A will be able to be flagged for myself and our presenters. So please, please, please put your questions in the Q&A box directly. If you have comments or questions at any time during or after the webinar, you can email us at hsrc@acl.hhs.gov. And I'm sure one of my colleagues will be putting that in the chat for you as well. And you can also use the chat or that email if you have a technical issue. Finally, please consider having your phone handy at the end of the webinar when we recommend resources both by QR code and by chat postings. These will also be emailed to you after the webinar. And most of you should have received the slides from today's webinar in advance, so you don't need to ask us that question, will I get the slides? Because you will be getting the slides if you don't have them already. And once the webinar is posted online, we will send you all an email letting you know that the webinar materials are available, which includes the slides, the recording, and the transcript. Okay, next slide. All right, so first poll, we'd like to get a sense of who's here today. So could you please respond to this short poll? Which of the following sectors best fits your organization? And we'll give you a minute to vote. So next slide, please. While you're voting, I'm going to share some information about the Housing and Services Resource Center. Next slide, please. Okay. So the Housing and Services Resource Center, HSRC, stems from a year-old partnership between ACL and other Department of HHS agencies, along with the Department of Housing and Urban Development. So launched in partnership between the U.S. Departments of Health and Human Services and Housing and Urban Development, the Housing and Services Resource Center fosters cross-sector partnerships between the organizations and systems that provide housing resources and homelessness services, healthcare and mental health services, independent living services, and other supportive services. The HSRC is part of an interagency initiative to streamline and expand access to affordable, accessible housing and the critical services that make community living possible. So after the webinar, I hope you'll take an opportunity to look at the HSRC website, which you can find at acl.gov/housing and services. Next slide, please. Okay, so please, I'm going to ask my colleagues to please close the poll. And while the staff displays the results, I want to remind everyone to please use the chat and Q&A function throughout the webinar because we really want to hear your comments and questions. All right, so it looks like the majority of folks, let me make sure I'm not missing anything. So we have a nice cross section here today. We've got about 29% of the folks are housing or homeless service organizations. 22% of you are from the disability or aging networks. We also have folks from behavioral, mental health, healthcare, public health, community development organizations, and other advocates and social service organizations. So this is incredible because we know that in order to address homelessness, it's not only the responsibility of the housing and homeless sector, it's all of us. So it is so encouraging to see you all here today on this webinar to learn more about partnerships. And for those of you who responded that you are actively supporting individuals with transition, please put into chat your organization's name and identify one key partner and say what you're doing together. Again, we'd like for you to use the chat to tell us about your organization and a partner that you have and a brief overview of your work together, because we may lift that up later on in the webinar. Next slide, please. All right, so we're here today to talk about solving for homelessness. And we've known for many years that people with disabilities are disproportionately likely to experience homelessness. And in more recent years, our homeless population of adults aged 55 and older has been growing. So one thing that both of these groups have in common is that for housing stability, they need not only housing that is safe and affordable, but also supportive services from the aging and disability networks and the health networks as well. So from your registrations, from the poll that we just did, we know that we have an amazing array of organizations from different sectors gathered here today. Each sector has its own focus, funding, and terms, yet we're all serving the same people. In fact, I guess that the vast majority of the organizations on this webinar serve people with disabilities, with older adults, or both. But yet our sectors tend to operate in silos and separately. And when this happens, people who are at risk of or are experiencing homelessness have to navigate each system separately, a task that can be incredibly difficult. We cannot advance equity without including as priorities these populations, which have encountered many injustices over the decades. Part of our push for equity means making our systems work for people, especially communities that have been marginalized and discriminated against. And for older adults and people with disabilities, that means we need to create more cross-sector partnerships, right? The onus should be on the system to work for people and be flexible to the needs of people, not the other way around. These partnerships are how we create bridges between our systems for housing and homelessness and the services needed by individuals who have disabilities and or are aging. Next slide, please. All right, so we're going to do some level setting now. I'm going to do a little bit of background information about the housing side of the house, and then later I'll give you some information about the services side of the house. So the Continuum of Care program which is housed at HUD, at the Department of Housing and Urban Development. It is a regional or local planning body that works to coordinate housing and services funding for people, for families and individuals experiencing homelessness. The COC is designed to promote community-wide planning and a strategic use of resources to address homelessness and to improve the integration and the coordination with mainstream resources and other programs that are targeting to people experiencing homelessness. That's why these partnerships are so important, right? The continuum of care needs to leverage not only the housing and the homeless resources in the community, they need to leverage the mental health, the behavioral health, the aging systems, the mental health systems, because all of these services, and combined with housing, are what people who are experiencing homelessness or housing instability, this is sort of the package that folks will need in order to be able to address their homeless situation. So the continuum of care, the housing piece is one part, and we'll talk a little bit about the services part in a minute. So next slide, please. So the continuums of care are national. They're all over the country, and introduced in 1994, as I said, they are community-driven processes to address the local needs and prioritize projects that apply to HUD for funding locally. So this is a map that shows the different types of COCs, and we've got a great example with us today from San Diego, and they'll talk about their work, but I just wanted to give you all a visual. There are rural COCs, there are suburban COCs, there are major city COCs, and everything in between. And later on in the webinar, we'll give you access to a website. If you're not connected to your local continuum of care now, we strongly encourage you to do so. It's a great resource. They need you just as much as you need them. So if you don't know how to get in touch with your local COC, we'll tell you how to do that at the end of the webinar. Next slide, please. So on the services side, the disability and aging networks, they make community living a reality for all people, regardless of disability and age. And these networks are made up of local, state, and national organizations and committed advocates working to support older adults and people with disabilities. Some of the organizations focus on a particular type of disability, age group, type of service, whereas others have a more comprehensive mission. Area agencies on aging, or AAAs, address the needs of older adults at the regional and local level through services and supports such as homemaker assistance, home delivered meals, any activity that would support independent living. The Centers for Independent Living, or CILs, they provide tools and resources and support for integrating people with disabilities fully into their communities to promote equal opportunities for them, self-determination, and respect. Some of the other parts of the networks are on the right part of the slide, which includes adult protective services, the elder rights and services, and councils on developmental disabilities. And you can learn more about these organizations that are on the slide on the link, which I think staff are putting in the slide or in the chat for you right now. So next slide, please. So continuing to give you some background about the Disability and the Aging Services Network, aging and disability organizations such as the AAAs and the CILs and other community-based organizations are established within their community, and they are well positioned to build partnership, as you'll hear from in a little bit. They reach into every community across the nation and serve diverse populations. These organizations are also staffed by people who live in and are experts about their local community and culture. In addition, they have decades of experience helping people access and receive vital home and community-based services, housing, and housing-related services. So through engaging in partnerships, the Disability and Aging Services networks, they streamline access to services for the people all of our organizations serve. Next slide, please. So we're going to talk a little bit about backbone organizations of these partnerships that we're hoping to lift up. Forming and sustaining partnerships across housing and aging, disability, and health services. We know it's not an easy task. That's why many community-based organizations serve as or are forming backbone organizations. In addition to leadership commitment, partnering also means ongoing efforts to coordinate. There's operational aspects as well, such as procedures and systems to share data, make referrals, and bring together supports in a cohesive way that fits with an individual's priorities and preference. These backbone organizations may even coordinate funding, undertake compliance or reporting, and train workforces. Different parts of the housing sector, including AAAs, continuums of care, and CILs, they can provide the essential infrastructure for forming and sustaining cross-sector partnerships. In a few minutes, you'll hear more from one of the COCs and one of the many partners that they have in their robust network. And also stay tuned in coming months on HSRC webinars, because you'll hear more about community care hubs, which are a growing infrastructure for coordinating health and social care. Next slide. All right, so let's get into what you all came here to listen to today. So it's my distinct pleasure to introduce two incredible leaders in their community and two folks that have just leveraged this wonderful partnership in San Diego. Tamara Kohler is the CEO of the San Diego Regional Task Force on Homelessness, and Kristen Smith is the Chief of Agency Operations for the County of San Diego Aging and Independent Services Division. So we'll hear first from Tamara to describe her organization and COCs. So I'll turn it over to Tamara.
Thank you, Lisa. And I think we'll go to the next slide, please. As Lisa said, I'm Tamara Kohler. I'm the CEO of the Regional Task Force on Homelessness. We are the Continuum of Care lead for the San Diego region, which includes the entire county of San Diego. So fairly large. We also have the city of San Diego as our role and responsibility. And as Lisa said, as a Continuum of Care, we are a planning body, but we are a convener. We are a facilitator of conversation, purposeful, local approach using both federal and state and local funding. On the slide, you'll see some of the things that we're responsible for, things like point in time count, administering the HMIS system, coordinated entry, we're a collaborative applicant, but we also are a robust community-based nonprofit, which is a little different. Continuums of care can be in local government, they can be in state government, county, or a nonprofit like ours. One of the strong sort of organizational strengths of Continuums of Care is we do a lot of our work based on the data we collect and what we know coming out of our HMIS system and committees. And so a number of years ago, we started seeing, as Lisa said, our largest growing population was our aging population, 55 or older, 25% of our unsheltered and about 25% of our sheltered population, over 50% experiencing homelessness for the first time, and over 60% reporting that they had a disability. At that time, we really reached out to our community partners, one of those being Serving Seniors. I know they're on this webinar. And their CEO joined our board and has really led an important panel and committee of where we've really addressed this work. So following data, local needs, and a committee approach is how we began to do this work and to begin to partner not only with the county and their work, but also with our community-based organizations and those with lived experience. So with that, I'm going to turn it over to Kristen.
All right, we can go to the next slide. Good afternoon, everyone. So Aging and Independence Services, or as we call ourselves, AIS, we are the Area Agency on Aging. And in our case, we are part of the County of San Diego, and we serve the entire county. You'll find area agencies on aging across the country in many different forms. Some will be independent nonprofits. Some big cities have like 5 AAAs serving one city. So they take all different shapes and forms. In our case, because we are part of the county, we also have a role as a community convener. We have what we call our aging roadmap, where we work with more than 10 different committees on various community issues that we all want to solve together, and housing is one of those. And then as far as our services, we have our AAA functions that are funded by the Older American Act, and some of them are on this slide. And then some of these other services on this slide are funded by state or local dollars. So on the independence end of the spectrum, we have health promotion programs, volunteer, and then moving towards a little further towards dependence, we have home delivered meals. Serving Seniors is one of our contractors for that. We also have many other contractors. Senior dining and caregiver support, and adult protective services is one of our very important programs. It's state funded. So we are that backbone organization with the Aging Network in San Diego with our many contractors. And we also have a call center, and every AAA has a call center to give information and assistance, not just for the services that we offer, but also for other community services. So if somebody needs home care and they're not eligible for one of the programs for low income people funded by Medicaid, they could get referrals to a private home care company, several of them. And so that's the type of thing that our call center does. We also do intakes for adult protective services and our other programs. And then we have an outreach and education team. It's small but mighty, 3 people who their job is to go and do presentations on all of these services. And with probably 500,000 older adults throughout San Diego, that's quite a challenge. So when Tamara's group approached us to do a training for the homelessness service providers, we thought this was a really great opportunity to build the partnership. We knew each other already, but we really started to deepen our relationship. We can go to our next slide, or Tamara, if you have anything to add to that.
Oh, you're good.
All right. So we can go to our next slide. Great.
I'm just talking and I'm on mute. Tamara, can you talk for a little bit about how your 2 organizations came together?
Yeah, thank you, Lisa. We work closely with the county in a number of different, I think, places and spaces, but intentionally, we worked with our community-based organizations that literally have a shared population. And the importance, as we brought this committee together, is the conversation about folks experiencing homelessness that are 55 or older have different needs, challenges with their ADLs, challenges with the way shelters are put together. Our great partner at Serving Seniors did a phenomenal research and survey in our community. And I want to highlight that as a continuum of care, we don't have to recreate things. We need to walk alongside our community-based partners in the work they're doing. And Serving Seniors was already leaning into a survey. We participated and lift that up. And some of the things that came out of that were transformational. Things like the shallow subsidies, looking at flexible funding. This importance of creating these age-friendly shelters was part of the conversation. We had shelter providers, some of them who are on the webinar, who want to meet that need, but didn't have specific training. And so our team reached out to Kristen's team and said, we have this shared population and the shared need is one of the largest growing populations, and we're concerned about the welfare, the safety of our aging population. Where can we come together? You do great trainings. How can we teach and train in our kind of industry the great work that you have and the resources? It was also the importance of connecting resources. And so, because we already had a relationship with the county, a number of their leadership is on our Continuum of Care board, it was sort of a natural connection, but this was very intentional with Kristen's team for their expertise.
That's so good. And what advice, Tamara, would you give to organizations about how to approach the COC? That's one of the things that I often hear from folks who are not in the housing sector. And Kristen, I would love to hear your viewpoint. Many of them are just concerned about, I'm not a housing provider, right? I'm not interested, or I don't have the capacity to do housing, but I do provide services. So what would you say to those types of organizations about the best way to approach the COC and say, hey, I'm here. I'd love to connect with you and be a part of addressing homelessness in our community?
That's a great question, Lisa. Continuums of Care are a membership organization, a general membership. So if you want to be in this work and you have a population, we're talking about the aging population specifically, but Continuums of Care need everybody in that mix. That's those that are at risk of homelessness, that is DV populations, youth populations, veterans. Aging is one of those. So reach out to your continuum of care. You don't have to be providing housing if you're providing services to a vulnerable population. You're part of your continuum of care and you just don't know it. So reach out to their leadership like me. We're listed on HUD's website. Call them, email them, let them know that you want to be a part of the support, the solutions, and really those wraparound services that are so critical. Your continuum of care will be an expert in your local infrastructure. Who's there in that space? They'll bring you in. I guarantee that every continuum of care just adds more seats to the table. We need everybody really invested in it. And the importance of sharing the understanding of these are our clients, all of our clients, and role and responsibility is powerful. So there are over 400 continuums of care across the nation. If you don't know how to find it locally, HUD has the resources and the contacts of how to get a hold of someone like me in your community. And I guarantee if they didn't already know where you were at, they will appreciate you reaching out and saying you want to be a part of the solution.
Thank you so much. And Kristen, for your perspective, right, as being housed in aging and independent services, housing sometimes can feel so overwhelming, right? What advice would you give to folks from your sector about thinking about housing and reaching out to their local COC?
So in our case, we had, as part of our work towards building age-friendly communities, we had started reaching out to various organizations in the county, like Serving Seniors and some other organizations. And they had joined we call it our Age Well Housing team. And that group was looking at some similar issues. It goes beyond homelessness and works on a lot of upstream issues like zoning and educating people about accessory dwelling units and that kind of thing. So I think it's almost like start anywhere, wherever you do have a connection. Start talking and building that relationship and find out who they know and what they can tell you. And of course, as we're learning here, go to the websites to find out, well, who is your official continuum of care? I think we learned it sort of organically by our relationships with the different agencies involved with the continuum of care. But if you don't know, obviously, you can go to those websites to find out who are the people in your area. And then just have a focused meeting on the subject. And figure out what you might want to do. So in our case, the Age Well Housing team was saying, oh, we want more age-friendly homelessness services. And then when Serving Seniors contacted us to say, hey, we're following up on this ad hoc committee recommendations. Would you spearhead the development of a training? We said, yes. So we can probably go to our next slide now, huh?
Great segue.
Yeah.
So yeah, could you talk a little bit more about this training? How did this come to be?
Sure. So they contacted us, and what we did is we got together a committee of a couple folks from Aging and Independence Services and a person representing the Regional Task Force on Homelessness, which is the coordinating body for the Continuum of Care, and also a representative from Serving Seniors, that key organization that serves a very low-income population and seniors experiencing homelessness. So our three agencies got together and looked at the results from the needs assessment that had been done by Serving Seniors and looked at what they already knew that homeless service providers wanted to know. And so we put together what we were pretty sure they wanted to learn, and then which took a couple months. And then we put together a pilot training that had a group of about 14, San Diego County is very large. And so a group of 14 service providers was small. And we did the training for them. And there's Matthew Percasio in the little screenshot of that training. And then we gathered feedback from them about what we should do more of, what we should do less of. And some of the things that were very important in our community among the homelessness service providers were, well, you see on the screen, one subject that has been very awkward, I think, for people to address is incontinence. And so we gave some questions, just the literal questions to ask to inquire about incontinence. And we talked about what resources they might use to address those needs. So some shelters have from donations, they have adult diapers. We talked about in the training how Medi-Cal can pay for some incontinence supplies. And so if their client is already covered by Medi-Cal, Medicaid in the rest of the country, they could get these. So that was one of the subjects that we covered. Another topic that was really important was learning about the different types of senior housing. And this probably varies some from state to state as far as the licensing, but across the country, we have skilled nursing facilities and we have assisted living, two different sets of licensing criteria and types of service that are offered in those facilities. And then we have what in the aging space, we usually call independent living, but it can mean so many different things. It might be just your own house, or it might be a big group of apartments that actually offers a cafeteria and meals. So there's quite a range. And so that subject of the types of senior housing, that takes up several slides in our training that we developed. So the training was about 90 minutes long and included those types of topics, including some of the funding, also an overview of our services and the services that exist from our partners in the community. And so the training, it's now on a website. You can download the slides, you can download the handouts. We have handouts on how to assess for activities of daily living and needs around that. Which is a big challenge that we're learning more about and now working together to try to solve some of those challenges. So this project, we had the pilot, we took the feedback, we did a bigger training, that was last October. We had nearly 200 people, local providers on that webinar. And then for a 90-minute webinar. And then we did a shorter version at our local conference that Tamara's group organized. And it's been very popular. So the project really got us thinking about the bigger picture issues together and deepened our relationships with each other too, to continue.
Yeah, no, Kristen, that was very, very informative. I was thinking about one of the questions that came into the Q&A about how did you deliver services for people who were unhoused? And you talked about like some of the ways that you all addressed shelters and provided other resources. I don't know if either one of you want to say a little bit more about that or expand upon the services that are provided to people who are either homeless or experiencing unsheltered homelessness.
I can say a little bit, and then I think Tamara will have a lot more to say on that. So at Aging and Independent Services, we recently, through state funding and as part of our Adult Protective Services program, we got some state funding for a program called Home Safe, which is specifically for older adults at risk of homelessness or already experiencing homelessness. And we're working with contractors, contracted providers to conduct that program. And so that's our first major foray into housing navigation. But most of the housing navigation that happens in San Diego County is done by the other service providers in the continuum of care. And so it's a matter of how can we make those services as age-friendly as possible. Tamara, do you want to add?
Well, thank you, Kristen. I'll just step back and say this training that we did that had over 200 participants and probably close to 100 at our conference were a number of providers at different levels within the continuum of care, from street outreach to our housing programs. And what we found is they really needed to understand where these other services were to connect to them. So one of the best connections that has come is, it's funny that with the incontinence, that is a big conversation in shelters. People are actually denied access to shelter or kicked out of shelters because of those challenges. And so this education and getting the right level of care and service so that our frontline workers knew how to address it and have the conversation and provide the needed, like adult diapers. Also being able to put someone close to the bathroom. A lot of time our aging population isn't going to ask for what they need. They're a little embarrassed to say, I need to get up in the middle of the night and need to be close to a bathroom. Changing our shelters, understanding that bathrooms need to be accessible 24/7. All of those things changes the way the system works and delivers services. And for our unsheltered population, really prioritizing shelter for our aging population. They are high risk on our streets. They have a reduced mobility a lot of times, many times having challenges with hearing or seeing or those kind of things. So one of the priorities that came out of our committee was having shelters that are dedicated for this aging population and making a priority population to be referred into shelter of our aging population, and then having the shelters meet that. We have a large unsheltered population in San Diego. About half our homeless population is sheltered, the other half unsheltered. So it's also having all of our outreach teams understanding how to connect an aging population to the needs that they have, including elder abuse that happens on the streets as well. So there's this important training and then bringing those services to them. So when we have teams that are bringing out, outreach materials, socks, and those kind of things, there are those, especially our mobile medical teams that can bring out other things for an aging population, which is really important. So it is hard with the unsheltered population that is aging, but we have made a commitment to prioritize that population for not only housing, but shelter that is organized in a way to meet their needs is really intentional. And we prioritize that population in our regional plan. And so we organize all of our effort and work around that.
Thank you. Thank you. Another question that came in from the Q&A, Kristen, you talked about being able to leverage Medicaid to pay for some supplies. We got a question about what federal sources of funding do you all braid together to be able to provide rental assistance to folks as homeless prevention strategy, specifically for older adults and people with disabilities. If you want to talk about some of the efforts that you all have worked on locally.
Sure. So, there's some funding, and clearly we're not meeting the entire need yet. And in San Diego County, we have some local funds from our county's general purpose revenue, which is being used for the shallow rental subsidy program. And that's a very small pilot. It's going to serve about 200 and something seniors who are at risk of homelessness. And by putting, I think it's about $500 a month directly to their landlord. So that's one program. With Home Safe, that is California state dollars. I'm not sure of all the intricacies of that. And then for Medicaid dollars, for older adults, if they're 65 and they have Medicare, you really have this, Medicaid is going to fill in some of those gaps. And in California, we have what we call, so we call Medicaid Medi-Cal. And in California, we have a large reform effort that's in place right now and kind of ramping up called CalAIM. And Medi-Cal has always paid for some incontinence supplies, some durable medical equipment, as well as the co-pays and the cost sharing for Medicare for older adults. So sometimes it's just a matter of making sure that the health plan in in San Diego, almost all of Medi-Cal is through managed care. So we have 6 different managed care companies that offer Medi-Cal to our residents, almost 1 million actually. And so sometimes it's just a matter of making sure that the health plan knows that this is an issue. We have some social work case management programs. One is in California, is called Multipurpose Senior Service Program, where a social worker, that's their job, is to do that care coordination and make sure that the older adult is getting all of the benefits that they're entitled to, and making sure that they do have any supplies and all the Medi-Cal benefits that they could have. And then through CalAIM, there's new supports that are being offered for older adults. And one of the, and for others as well, not just older adults. So homelessness is one of the populations of focus in CalAIM. So they're beginning to spend Medicaid dollars on things like housing deposits, security deposits, and help in that coordination and move to one place to another. And my understanding is that through the different Medicaid waivers that happen all over the country, different states are finding different ways to use the Medicare waiver process to come up with creative ways to start to address more of the social determinants of health.
And Tamara, you were really intentional about saying in the beginning that these are all of our clients, right? Like people may come in one door, they may come in through the homeless system, but they also, you know, can tap into services from a AAA or a SIL. And same, Kristen, like they may come in through a SIL or behavioral health or mental health organization, but if they have, you know, a housing or housing instability issue, right? Like they, you know, they could be folded into the COC. So thinking about that, right, in the different sectors and silos we talked about, there's also this data piece, right? You both also are, you know, I know compliance and reporting, you know, is big for, you know, organizations that receive federal funding. So can you talk about like data? How do you manage data on folks that, you know, are being served in multiple places in the system? That was one of the questions that came in through the Q&A. So really curious to hear your approach to that, because that sometimes can be a barrier for partnerships, right? Organizations feel like, you know, we don't want to duplicate services. So really interested to hear how you all navigated that.
Well, thank you. You know, I mentioned it in the beginning, data really informs our work. So leaning into this population, it also means that we need to know sort of the rules of engagement with data, how to protect personal protected information, but how to partner with not only your providers, but some of your larger counties or those. So at different times, we have done data matching with the county to look at populations that we have that are similar. Also, I think it's important as we have these strong partnerships and we may be doing the housing, say with rapid rehousing or shallow subsidies, that client base many times through the community-based organizations, that they're able to connect to other services, because we know that it's not enough just to get people into housing. They need to stabilize, which means that's that community support. That's why all of these services, whether it's prevention, literally experiencing homelessness, or being housed and needing to stabilize, that we need these partnerships. And anywhere where we can share data for care coordination, we have a 211 that has a community information exchange, that we have a shared disclosure that allows us to share some of our HMIS data with it. I think we need to just know how to use the data in a care coordinated way. And we're doing that now with the health plans. I think we went from very siloed approaches to data to really looking at, you know, that is not the most trauma-informed way to do this work, and we can't do it alone, nor should we. And so the importance of understanding they are shared clients, and any way that we can partner moving forward, especially not only from the emergency response, but from the housing stability side. So a lot of our rapid rehousing shallow subsidies, if we're starting at 55, how important it is to have those county connections, the CalAIM, but also to get them through the next, like 10 years to apply for SSI that can really help with their housing to stabilize. So we need long-term planning with really important intentional approaches and steps along the way. That does mean sharing data. It depends on your environment. It depends on what that looks like, but we share it through a couple of different intentional ways while protecting the client's, information. And it is only if it is a part of your work that people are accessing it. So it shouldn't be sort of an place we don't want to navigate to. It should be a place we're understanding how best to do it. Because anytime a client doesn't have to continue to share their story and we can coordinate care, we are reducing trauma, we're reducing harm, and we're actually getting them to the end result quicker.
Thank you. Thank you. How would you all describe how the voices of people with lived experience have influenced this partnership and this work? And can you talk a little bit about the role that people with lived experience plays in informing and just lifting up all that you all are doing together?
I could probably take that and then pass to Tamara for this one. So in our work as a AAA and also as the county and our role as convener for the public to work on different issues, we make a point of reaching out to our own clients in our various programs, making a note of, what kind of calls are we getting in the call center? And for instance, in this, with this subject, we have noticed over the last few years, a great increase in the number of calls from older adults who are about to lose their housing for one reason or another. So that's one, is just listening to our own clients. And then on things like our Age Well Housing Committee, when we were first developing our goals, we had the input of people who actually joined our committee who were housing insecure and letting us know about what some of these major needs are. And so that helped inform what our goals are and what we were going to work on. And then as for us, we're going into a new cycle of developing every AAA does an area plan every 4 years. And so we'll be doing a series of listening sessions this coming fall. And those listening sessions will include housing as a major topic. And that'll be directly with older adults. So. And Tamara, I'm sure you have way more.
A continuum of care. We thrive on having the voice of lived experience at the table, centering it in our work. As our continuum, we have a 31-member board, and nearly a third have lived experience. So not only do we have them from a number of different areas, but really representing a number of the needs and populations. They are on all of our panels, all of our committees. It's important that they lead those discussions in a lot of ways. And then having the community-based organizations who are also hearing from their clients and have that lived experience. So not only do we want folks with the current lived experience, so a lot of the needs assessment that was done is for folks who are currently experiencing homelessness. So you need to continue to get feedback continuously through this work. You'll have your experts with lived experience who are comfortable being on committees, can dedicate time. I will also say that we compensate those with lived experience, whether it's stipends, whether it's gift cards. Some we've worked with so much that they are now consultants, and we work through how to make sure that doesn't affect their benefits in a lot of ways. But we are, committed to the changes in our system that are needed to fully address homelessness, including the racial disparities that we see that are profound. And you cannot do this work about people without people leading it who really have the experience. We learned so much every day from them. And folks who experience homelessness in our system 5 years ago who are housed didn't have the same experience as people are today. So it's important to always have new, fresh, and important voices, but honor all of those in our work. And we are very intentional to center it in our work as well.
Partnerships take time, and this is hard work. Someone put in the chat about the number of committees that you all mentioned, and just wondered if that was an effective way, or if you find it effective way to do work. So I've got a couple questions from that. how do you find the time in your busy day to do and nurture and establish these types of partnerships that we see, in your case, can be very instrumental and beneficial for addressing homelessness for older adults and people with disabilities? But these partnerships are hard, right? And it's on top of the other work that you have to do. So number one, how do you find the time? And then number two, how do you pay for it? You know, how do you pay for the additional meetings and the additional hours of staff time and the consultants that you're bringing to the conversation? So we'd love to hear you all talk about how you sustain the work that way.
Kristen, you want me to go first?
Sure.
Yeah. So because we are not in government, we are truly a nonprofit. So we do have a planning grant through our HUD funding. I'll just say a planning grant is not enough to get this work done. But we also have funding for our HMIS and our coordinated entry. We have a small but mighty team of about 30 people. But if you think it's a like 3.2 million people population, that's not a very big team for the work we do. And so we cultivate relationships that help us do this work. So not only how do we pay for our own staff, but all of our committees are very intentionally organized around now our regional plan. There are a lot of areas and directions you can go. We're intentional about what committees, we have work plans for those committees. We have committee chairs who also sit on our board. So there's this shared commitment and prioritization of others' time. Our organization's role is to singularly do this, host those, convene those, build the relationships, fund programs, oversee the data, but it really means we prioritize it well. We staff these committees with admin support and direct staff from the continua. So I think people feel like with everything else I'm doing, it's a lot of work to do committees. I believe that if you have strong work plans that tie back to your plans and goals, it comes together in a really intentional way that isn't just conversation, it's driven to action and outcomes, and people stay engaged when you're doing that. So I know it's a lot of work, it's a lot of relationship building, it's a lot of messaging, it's a lot of keeping people engaged, but our committees in San Diego are robust. They're well attended, and they actually provide actionable recommendations to the Continuum of Care board that we put in action, and you're hearing about one today. So important to do it.
And here at the county, in Aging and Independent Services, we use a mix of funding for that type of committee work. For our outreach and education efforts, we have some funding from some of the major programs that we're doing outreach on. And then we also, community engagement is an official key value, core value of the County of San Diego in our framework for the future. And so spending our local general purpose revenue dollars on some of that work, because it's an investment where you're hearing from the community and working alongside the community in towards goals. So we're going to have better outcomes if we do it that way. And so we're able to use some local funding for that kind of community work.
And Lisa, I just wanted to, because I know we have a lot of continuums of care, they come in all sizes. And for some, for us to say we have 30, a staff of 30, they'll tell you they have 3 or 4, right? And so I think it's the importance of finding the partnerships in their community. I recognize we're a larger continuum of care, but also as a nonprofit, we've been able to bring in additional funding because we can fundraise to have a robust team. So I would say to all of your partners of those continuums of care, any way you can help support them, provide staffing or even funding so that they can facilitate this work is critical, because it is HUD's intent that we're doing this as a community, so that it is not fully funded by HUD to really do the robust level of work. And it means asking your community to not only provide great people on your board, but potential funding to do the work as well.
Thank you. Thank you. Such good information. We've had so many good questions, and we would be here for another hour at least to get through the questions, but I really just want to, Tamara and Kristen, thank you so much for that wonderful overview of how you all came together in San Diego and developed this partnership. And you all are focused on people over 55 who are experiencing homelessness, but a lot of the principles that you lifted up could be applied to other populations, including people, survivors of domestic violence and human trafficking, and you know, veterans and families with kids, and you know, all of the population. So really appreciate your expertise, and definitely want to continue to lift up your work, and wish you all great success. So we hope that you all gained an initial understanding of how this partnership was formed in San Diego, and it sort of sparked a way for you to replicate in your locality to serve people experiencing homelessness, and to make sure that you leverage the resources in your community, particularly for populations that need a combination of housing and services from the aging and disability networks, so that people have access to health and housing stability. So I'd like to challenge each of you to take one small step today to create a new or expand an existing cross-sector partnership. And we're going to look at some tools that we have available to help you apply what you learned today. And there are some QR codes that will pop on the screen later if you want to have your phone handy. Next slide. So here are the QR codes for the HSRC roadmap. That was the previous slide, but you can find more information around directories for your local partners. And then you can also find out some of the acronyms that we mentioned today. Each sector, like we said, comes with different philosophy and data and reporting, and we also come with different languages and acronyms. So it's really important to level set and make sure we're speaking the same language, so we're providing you that resource as well. Next slide. And as I mentioned in the beginning of the webinar, you are wanting to find out who your local COC is. You can reach out to the HUD Exchange website and click on your state and community and find your local COC. And if you're having problems finding that, you can definitely email us at HUD. One of the ways that you can reach us is snapsinfo@hud.gov, or also there is an Ask a Question help desk link that I think is on the next slide, or maybe slide out. Yes, you can go to hudexchange.info.grantees to find local grantees, or submit a question to the Ask a Question link that you have there. You can just say, hey, I'm in Indianapolis. I need to know who my local COC is. I work with a AAA. I work with a Center for Independent Living, and I need to know who I should reach out to. Next slide, please. So thank you all for today. We're getting so many good recommendations to you all for additional trainings and resources that you'd like to see. So please continue to send those to us via the HSRC website. And also, please help us improve by completing this short feedback form so that we know how to make these webinars more valuable to you, and most importantly, practical, right? There's so many demands on our time. We wanted to make sure that we were giving you relevant information that you could take back and replicate in your communities. Next slide. Like I said, we want to hear from you. So please email us at hsrc@acl.hhs.gov. And before we close, I want to remind everyone that in the coming days, we will post the recording of this webinar and the slides on the HSRC website. In the meantime, keep using the website. It is your resource center, and definitely continue to email us about your technical assistance needs. If you heard something today that you wanted to learn more about, please reach out to us with those TA requests, website suggestions, and lift up your work. Your own cross-sector partnerships. We'd love to hear from you, maybe love to feature you in a future webinar. And then finally, definitely want to thank you all for your time today. Want to thank Mission Analytics, US Aging, Catherine, our lovely ASL interpreter, Heidi, our CART specialist, for their roles in producing today's webinar. And I want to thank my colleagues at HUD and HHS who are in the background, answering questions and responding to your messages in the chat. So it's 4 o'clock. We are very respectful of your time. Don't want to keep you over. Thank you all so much. And I hope that you found this information helpful. And this isn't the end. We can continue to have these conversations. So please keep the feedback and questions coming. Thank you so much. And thank you all for the work that you do every day.